Neil Woodbridge, Chief Executive of Thurrock Lifestyle Solutions, your health day today here, very busy. Give us a little overview of what the day's about.
Right, sure, Michael. Yeah, I mean, obviously, actually, it's not our health day. We've sponsored the day, but we're working very much in partnership with South Essex Partnership Foundation Trust, the SEPT nurses. We're also working with Thurrock Health Watch. The idea is that the fact is that people with learning disabilities are not having their annual health checks in Thurrock, and we're very concerned about that. So this day was organised between all of us to get as many people here at the Civic Hall in Blackshots, to get as many people here as we can to look at their health issues.
For the uninitiated, if you might sound a stupid question, what is a health check?
Right, sure. The government's very concerned. If you've got a learning disability, it's quite likely that you will die 13 years younger than someone without a learning disability. And it's nothing to do with your impairment, it's actually because you're not noticing things that are going wrong with you. And the government says that everybody with a learning disability should have an annual health check with their GP, and that's what we're promoting today.
Are any GPs here today?
We haven't actually seen GPs because they're all very busy people, as you know, but we have seen lots of their staff, which has been brilliant. So some of the good surgeries that we know have sent their practice staff down here and they've been amazed.
Now, I believe there's a little route, if anybody gets a passport check and there's a route?
Yeah, we've got a passport. Basically, the idea is you take your passport, you walk around all the stalls and you have to get 6 stamps. And if you get 6 stamps, you get what we've called a graze, spelt with a Z, a graze bag, which is healthy little snacks that you can then eat. At the same time, we do a survey to find out about people, what they think of health checks, whether they've had them, so we're getting lots of data back.
There are a lot of organisations here today. Do you feel like you've been very, like the glue that keeps them all together?
In some ways, I think people are very passionate about health, and so it's the issue, the subject matter that brings people together. But yeah, we've been banging on about this for ages, as has indeed Health Watch and our SEPT nurse colleagues.
What do you hope? How will you gauge whether today is a success or not?
Well, we've got some boxes in the corner that have got smiley faces on, and we've asked people to put their thoughts down on there in relation to whether they will have a health check going forward. So we'll literally be able to count the number of people that have been through. At the moment it's exceeding 200, so we're delighted. But the number of people that have been through, whether they'll actually have a health check, and then we'll look next year's statistics to see if we've had an impact.
Thank you very much. Claire, a busy day here at the Health Day. Tell me which organisation you're from and what are you doing?
Okay, we work for SEPT, which is the local mental health and learning disability trust, and it covers different areas from Thurrock through to Southend. We're predominantly health facilitation nurses, so we work with people with a learning disability to help them with their healthcare.
I'm going to switch to Jean now, and Jean, for the uninitiated, what is a health facilitation nurse?
Health facilitation nurse job contains many facets really, but one of the big changes for health facilitation nurses is to try and make people aware of the importance of an annual health check and try and make sure that people with learning disabilities have equal access to healthcare and make sure their health needs are addressed.
Why do you think that in some areas, without getting into the politics of it, because there's not enough politics at the moment, why do you think there is a struggle to get people to get health checks with people with learning disabilities?
And that's something our role is trying to address by providing GP training to surgeries across Thurrock, and in the girls in the other areas are doing that as well. I think politically people with learning disabilities, their health needs have not been addressed, or maybe people don't advocate, are not aware, and we've got evidence to prove that the mortality rates are lower than the general public, and we want to try and change that.
Claire, what do you hope to get out of today?
We hope that people will go along to their GP surgeries and be armed with shed loads of information to be able to go along to them and say, hey, we really need this annual health check and we want to be counted and we want to get the same services as the general population do.
It's quite a simple situation, you know, that a carer of somebody with a learning disability can just make the appointment, so this is what I want. And if the appointment's in June or July, so be it, but we can get that check done.
It is as simple as that, as ringing your GP surgery and saying, you know, we're entitled to this service. And if that GP surgery is signed up, then they have a duty to provide that to that client. And it is just literally booking an appointment with whoever in that surgery carries out the annual health check.
We've got some practice nurses here today who are, their surgeries have signed up for the annual health check, and they're helping out today, which is fantastic, because what we want to do is make sure that reception staff, telephone staff, all hospital staff know that a person with a learning disability is entitled to a reasonable adjustment, because sometimes in our service group need a longer appointment, and that's something under the Equality and Discrimination Act they're entitled to have.